Hi, my name is Dr. Caitlin Testa. I'm one of the doctors here at Essex Union Podiatry. Today we're answering some questions that we commonly get from patients. The next one is a question about a 7-year-old and the parent's concerned because she walks constantly with her toes pointed inwards. Her pediatrician said she'd grow out of it, but she's getting worse and other kids are starting to notice. At what age does intoeing become something that kids outgrow and it becomes something that needs to have a podiatrist intervene before permanent damage occurs? Generally, the phrase "she'll grow out of it" is appropriate advice for a child who's 3 and under. For a 7-year-old that has pain, that has worsening intoeing, that trajectory changes the clinical calculation entirely, and waiting longer without evaluation is no longer the safe choice. Intoeing originates from 3 anatomical levels of the lower extremity, so you have to evaluate where it's coming from. Is it coming from the hips? Is it coming from the knees? Or is it coming from the feet directly? The fact that your daughter is worsening at 7 suggests either the underlying rotational abnormality is more significant than was initially assessed, or compensatory gait patterns are creating secondary biomechanical problems. Here at Essex Union Podiatry, our pediatric podiatry team evaluates the rotational profile systematically. I measure different calculations from the thigh foot ankle through the knee and kind of see how does the foot align to the rest of the body. Any frequent tripping as well can cause a real injury risk, especially in school-age kids. They're starting to get into sports, they're running around, they're playing at a more elite level. So we really want to make sure that kids are wearing the appropriate shoe gear and that we're intervening however is needed, whether that's conservative with shoe gear changes and orthotics, or if it's something on the surgical platform.